Hey everyone, and welcome to this explainer. Look, if you're tuning in, chances are you or maybe someone you care about are gearing up for an anterior cervical disc replacement with Dr. Lomedico. And let's be honest, it is completely normal to feel a little bit anxious before any kind of surgery. But the absolute best way to conquer that anxiety? That's right, it's knowledge. Today, we're going to take those dense medical handouts and transform them into a crystal clear, easy-to-follow roadmap. We're breaking down Dr. Lomedico's highly customized approach to your care, covering everything from how to prep right through to your recovery. I'm super excited to guide you through this so you can walk into your procedure feeling totally confident and prepared.
Okay, let's dive into this and give you a quick overview of our plan. We're going to cover understanding your neck pain, what a disc replacement actually is, prepping for surgery, what to expect on the day of, managing your surgical drain, and finally, your recovery milestones. Basically, we're walking through the whole thing chronologically. No surprises, just a clear step-by-step guide.
All right, Section 1, Understanding your neck pain.
Before we even talk about the fix, it's incredibly important to validate what you've been experiencing. That neck pain, the numbness, the weakness, it's not in your head. It has a very real physical cause going on in your cervical spine. To really understand it, we need to talk about a medical term called stenosis. Now, stenosis simply means a lack of space. When the discs in your neck start to wear out or herniate, they take up the room that is supposed to belong to your nerves. And when those tiny nerve roots get squished, you end up with something called radiculopathy, basically a severely pinched nerve. Even though the pinch is happening up in your neck, the symptoms travel. That is exactly why you're feeling that terrible pain or tingling shooting all the way down your arm or into your hand.
And this brilliantly illustrates exactly what's happening under the surface. Think of your central spinal cord like a massive, high-speed interstate, with all these smaller nerve roots branching off like exit ramps. If a damaged, bulging disc blocks one of those tiny exit pathways, it acts just like a massive roadblock, creating immense friction and pressure on the nerve. Our goal? We're going to clear that roadblock.
Moving right along to Section 2, what is disc replacement?
So how do we actually get in there and clear that roadblock so you can get your life back? Well, that brings us to the procedure Dr. Lomedico recommended, an anterior cervical disc replacement. The word anterior is just a fancy way of saying we go in from the front. Dr. Lomedico makes a super small horizontal incision. We're talking literally 2 to 3 inches long, right on the front of your neck. By taking this route, the surgical team can safely and gently move your soft tissues aside to get to the spine, and carefully pull out that damaged disc without ever disturbing the actual spinal cord behind it.
Now here is the real game changer. This is where this procedure is completely different from an old-school spinal fusion. Instead of locking those neck bones together so they can't move, Dr. Lomedico swaps out your bad disc for a state-of-the-art artificial joint. Think of it kind of like a tiny ball-on-socket mechanism. This incredible little device doesn't just restore the space to get the pressure off your nerves, it actually lets your neck keep its natural, normal range of motion. Pretty amazing, right?
Which brings us to Section 3, Preparing for your surgery.
Now, for this beautiful piece of engineering to work perfectly, you actually have a pretty vital role to play before you even step foot in the operating room. Let's talk about your homework. First, we have to make sure you are in tip-top shape, so you'll need medical clearance from your primary care doctor or your cardiologist. Then, about 1 to 2 weeks before the big day, you'll have a pre-op appointment with Dr. Lomedico's team to dot the I's and cross the T's. Oh, and definitely coordinate your ride. You need to plan logistics because most patients go home the exact same day of the surgery.
So, the absolutely crucial point that we really need to hammer home involves your medication. Exactly 1 week, 7 full days before your procedure, you have got to stop taking all anti-inflammatories and certain supplements. I'm talking Advil, Aleve, Motrin, all NSAIDs, plus stuff like fish oil, omega-3s, turmeric, and vitamins E and C. Why? Well, they thin your blood. And if your blood is too thin, you have a much higher risk of excessive bleeding during surgery. And trust me, you want to minimize that, because bleeding drastically increases the chances that you'll have to go home with a surgical drain.
All right, Section 4, the day of surgery.
Okay, you did your homework, you stopped the right medications, and the big day is finally here. Let's take the mystery out of it. Your procedure will happen either at a hospital or a specialized surgery center. You're going to be completely and comfortably asleep under general anesthesia. And like we touched on, the vast majority of people wake up, hang out in recovery for a bit, and then head right home to sleep in their own beds that very same day. Now, in a few specific cases, a short overnight stay might be needed, but generally expect a super quick transition back home.
When you wake up, you're probably going to be wondering about your incision. Well, Dr. Lomedico utilizes a fantastic, incredibly patient-friendly approach here. The incision is closed using absorbable sutures that are tucked completely under the skin. What does that mean for you? No pesky external stitches that need to be painfully snipped and pulled out later. Oh, and no steri strips either. It makes keeping the area clean and managing your early recovery so much simpler and a lot more comfortable.
Now for Section 5, Managing Your Surgical Drain.
Now, what's really interesting about this next part is how straightforward it is. Depending on how much oozing happens during your surgery, you might wake up with a little device called a surgical drain. Please don't let this freak you out. It is a totally normal, standard tool for healing. If Dr. Lomedico decides you need one, it's just there to safely pull any excess fluid away from the surgical area. If that fluid stayed trapped inside your neck, it could build up painful pressure or cause an infection. The drain just gives all that fluid an easy escape route into a small plastic bulb, which usually just gets pinned right to your shirt so it doesn't pull.
If you do go home with one, managing it is a total breeze. Basically, every 12 hours, think once in the morning and once at night, you'll just pop open the little stopper, pour the fluid into a little measuring cup we give you, and write down the amount. Then, and this is the really important part, to keep that gentle suction working, you just squeeze the bulb completely flat in your hand before you pop the stopper back in. And that's literally the whole process.
Over the next day or two, you're going to see your body healing in real time. On day 1, the fluid is going to look pretty red. But by day 2, it fades to a lighter pink, and then it shifts to a clear or light yellow as the amount drops off. The office is going to call you to check your numbers, and usually within just 1 to 2 days, maybe up to 3, you'll just pop into the office and the drain gets quickly and painlessly pulled right out.
And that leads us to Section 6, Recovery and Healing Milestones. Once the surgery is done and the drain is out, you hit the best phase, getting your life back. Let's move to the fun part and see how this builds. For the first 2 weeks, Dr. Lomedico might have you wear a soft cervical collar. But remember, because you got an artificial disc and not a fusion, this collar is purely for your comfort while your neck muscles calm down. After just 2 weeks, bam! You basically have zero restrictions on your daily movements. And depending on how intense your job is, most folks are completely cleared to get back to work anywhere between 2 to 6 weeks post-op. Now, during those first couple of weeks, we really just need you to use some common sense. Do not submerge your incision underwater. So no bathtubs, no pools, until it's totally sealed. Stick to regular showers where you just gently pat your neck dry. Absolutely no driving if you are taking prescription narcotic pain meds. And please prioritize your sleep. Getting a solid 8 hours a night is exactly when your body goes into overdrive doing all its cellular repair.
Oh, and there is one super specific rule you've got to remember, and it involves the dentist. You now have a brand new fancy artificial joint in your neck. Even a routine dental cleaning can actually release a bit of bacteria into your bloodstream, and we do not want that traveling to your new joint. So you absolutely must wait a minimum of 3 months after your surgery before having any dental procedures or cleanings whatsoever.
Now, complications are incredibly rare, but we want you to know you're never alone in this. Dr. Lomedico wants you calling the office immediately if you run a fever of 101.4 degrees or higher, if your incision starts straining unexpectedly or pulling apart, or if you get hit with severely increased pain that your meds just aren't touching. A little numbness or tenderness around the incision, totally normal. But anything severe, pick up the phone.
So we've gone through the whole shebang, right? From the anatomy of your pinched nerve to Dr. Lomedico's surgical magic, all the way through your recovery roadmap. The medical side is handled. So I want to leave you with this. Instead of focusing on the anxiety of the surgery, focus on the finish line. Once that nerve pressure is completely gone and those 2-week restrictions are lifted, what are your personal goals for a pain-free life? Are you getting back on the golf course, finally playing with the grandkids, or just sleeping through the night without pain? Keep that goal front and center. You've got this. Thanks so much for joining me for this explainer, and we're wishing you a really smooth, successful recovery.